This is Med School Radio. You're back here again with Med School Radio. Thanks very much for joining me again. This time we're looking at Mycobacteria, the sketchy micro. And we're looking at the PDF here. I'm looking at an image from Sketchy Micro. I don't know if you have it in front of you. Anyway, we're looking at a sort of a Western scene. This is Mycobacterium tuberculosis, shootout at the TB Corral. So we're looking at some stores in the background, the gun complex, Lowenstein's General Store, We Carry Bellows, a sign at the top of one of the stores, and there's a guy in jail. He's coughing into a bloody handkerchief and has the macrophage theta sign on the jail cell. Next to him there's a guy being lassoed by another cowboy standing next to cactuses, and he's standing on a millet sign, and he's shooting some guy, knocking off his hat with a bullet, and who's next to some pots. And there's a guy in front, tied up in front of a TNF, looks like gunpowder, and a BCG injection sticking into the ground, and a boy sitting inside a sack. Anyway, let's go ahead and read the PDF. So, starting with number 1, pink gun, leaving a pink finish, the guy shooting the pink gun. Acid fast is represented by the mycolic acids, carbol fuchsin stain, i.e. the two branched tassels representing mycolic acids. 2, Lowenstein's General Store, Lowenstein's medium. 3, the bellows, obligate aerobe. 4, the cart, transmission is human to human respiratory droplets and proliferates in macrophages. 5, the cart, macrophage cage. 6, glycolipids are responsible for clumping of bacteria into a serpentine formation. Virulence factor is called cord factor. 7, the lasso wrapping up the driver of the macrophage cart. Cord factor will increase granuloma formation by increasing TNF-alpha, activating other macrophages, walling of itself into a granuloma. This will protect the bacteria. 8, spurs kicking up dust clouds behind the cowboy. Sulfatides preventing phagolysosome fusion, allows TB to survive in macrophages by creating incompetent secondary lysosomes, preventing fusion to, it says hydrolysis, I guess hydrolysis, I don't know. 9, a cactus with holes in the middle lobe and red cactus fruit near the hilum, gun complex. Primary infection, gun complex. Primary infection, healed infection, affects the lungs and will form a gone complex. Visual calcification, right middle lobular hilar lymph node involvement. Number 10, the carts that are broken down, caseation, granulomas, tubers, represents the tuberculosis, which resides in broken down necrotic macrophages, the Langerhans giant cells. Number 11, the sick child in the burlap sack, primary infection symptoms, lung fever, and in children resolves by fibrosis, burlap sack. 12, shovel with dirt, test for TB with PPD, BCG vaccine will always show positive skin test. 13, millet speed pouring out of the cart, millet seed pouring out of the cart, and cow skull, miliary TB, multi-organ failure, millet seeds from the macrophage cart, which is lethal. 14, the guy strapped to the barrels of TNF. It's a latent infection associated with immunosuppression through downregulation of TNF-alpha release. Immune system is defenseless if TNF is inhibited. Always screen for PPD before using a TNF inhibitor like infliximab. Right cactus with holes in the upper lung scenes take place at night. Reactivation is on the upper lungs. Look for a cough, night sweats, bloody cough, hemoptysis. 16, the prisoner in the M alpha macrophage alpha cage. Reactivation occurs in macrophages. 7, coughing out blood in the handkerchief promotes body wasting. 18, the broken pots. Pott's disease is dissemination of the bone to bone, spinal weakness. 19, the bullet hole going through the hat. CNS involvement is also seen as meningitis or tuberculoma, hat being shot off. 20, treatment, combination of RIPE, rifampin, isoniazid, pyranezumide, and ethambutol. And 21, prophylaxis with rifampin or isoniazid for 9 months. So there we have it, Mycobacterium tuberculosis, shootout at the TB corral. This is Mycobacteria from Sketchy Micro. Check it out on Sketchy Micro. Thanks very much.